Hello and welcome to this month's Masterclass all about skin cancer. So we're heading into summer. It might be on your mind to learn a little bit more about skin cancer so you can kind of get your head around the idea. So there's a lot to talk about with skin cancer, especially for me because it's my area of specialty. So that's what I've specifically trained to diagnose and treat. So I did a 1-year fellowship at the end of my consultant training in order to specialize in the treatment of specifically basal cell carcinomas, but all types of skin cancer. So it is something that I personally know a lot about. I don't talk about it a lot on Instagram because it's not kind of mainstream, but I think heading into summer, this is the right time to bring it up, and using a masterclass as a format means if you're interested in this topic, you can listen to it and watch it. And if you're not, you can just skip it. 2 main points though. So if you are watching this and you're only going to watch the first 60 seconds, the 2 things I want you to get out of this masterclass are: the first is that skin cancer isn't just one thing. So skin cancer is a range of what we call lesions or things on your skin. So it's not just a brown mole or potentially a brown mole that goes funny. It's a couple different things. So that's the first thing to recognize. And the second thing is that if you have a new lump, bump, or a mark on your body that's changing, or bleeding or anything going wrong with it that you're concerned about, get it looked at by your doctor. So do not ignore a changing lesion. Go and get it checked out. If it's been a week or 2 and it's still kind of acting funny, that's kind of your cue to make an appointment with your GP or your primary care physician to have it looked at. In the UK and in most parts of the world, we have a 2-week rule. So if you're referred to by your GP for any query cancer diagnosis, you will be seen by a specialist. So in my situation, it would be a dermatologist who would see you and review your lesion within 14 days of that referral being made, and treatment and so on should happen within 31 days, 62 days, and so on. So we have these specific targets, which in the UK, we're very, very good at meeting. So if you live in England and you're worried about cancer of any kind, or skin cancer specifically, absolutely go to your GP, voice your concerns, and have your GP refer you if it's appropriate. So those are the 2 things. Skin cancer isn't just one thing, and always get a new lump, bump, or whatever checked out by a doctor who knows what they're looking at. All right, so now we've gotten through that. Now, the first thing I'm going to say about skin cancer is that it's not just one thing. So there's basically 2 categories of skin cancer, and that's how you can think about it. There's melanoma skin cancer, and that's what most people think about. They think about melanoma, which typically occurs as a brown mark or a brown spot on the skin. It's not always brown, but for kind of this scenario we're talking about here, we're going to talk about brown spots. So melanoma skin cancer would be your brown, freckly things that kind of grow and change. And those are your most serious. That's your most serious form of skin cancer. So melanoma is the one we worry about the most. So it's a changing brown mark on the skin. That's what we're concerned about. Only 40% of skin cancers, melanomas, arise from pre-existing moles. So if you have a new mole, especially if you're like over 35 or 40 years old, you shouldn't really be developing new moles. And if you are getting a new mole, get that checked out by your doctor. The other category of skin cancer is referred to as non-melanoma skin cancer. So that's everything that's not a melanoma in the world of skin cancer. So the 2 main categories in non-melanoma skin cancer are basal cell carcinomas and squamous cell carcinomas. And those names derive from the cells which the cancer comes from. So like, for example, melanomas come from melanocytes. That's where the melanocyte is growing in an uncontrolled way. And you have a proliferation or lots of melanocytes, and that forms your melanoma lesion or skin cancer. With basal cell or squamous cell carcinoma, it's the basal cell that replicates in an uncontrolled way, and that's the name it's given to that lesion. So non-melanoma skin cancers are actually way more common worldwide than melanoma is. So just some stats from the UK, and this is coming from Cancer Research UK, which is a very, very good website if you're looking at statistics. From 2016 to 2018, there were 155,985 new cases of non-melanoma skin cancer, so just under 160,000 people. And with melanoma in the same time period, there were 16,744 cases. So we're looking at 160,000 non-melanomas versus roughly 17,000 melanomas a year. So the non-melanoma ones are actually way more common. Now, the main difference here is that non-melanoma skin cancer is much less likely, or virtually very unlikely, to kill you, which is good, while melanoma has a higher chance of killing you. I know we don't like to use the words killing and death, but I have to kind of be straightforward about this. With melanoma, there's 17,000 roughly cases in a certain period of time. And in that same period of time, there were 2,333 deaths. So that's a lot of deaths related to the amount of people getting melanoma. While with non-melanoma skin cancer, the deaths were just over 1,000. So you have way more cases of them, but way fewer people dying. So the cancers are very, very different. Now, the main difference between melanoma and non-melanoma is generally that non-melanoma skin cancers won't ever spread. And when I talk to a patient about basal cell carcinomas, I say it will never spread and will never kill you, which is pretty much correct. With melanoma, I can't really say that. There's always going to be a small risk that it may spread down the line or in the future, even if it's completely removed. It does depend a little bit on what kind of melanoma it is, but generally speaking, it can spread, while the other type, non-melanoma skin cancer, doesn't spread. So, two different categories. Now, with non-melanoma skin cancer, the most common one is the basal cell carcinoma, and that is mega common on the face or the head and neck. That's what we usually call the area head and neck. And they present as little skin-colored bumps on the skin. So they're not usually brown like moles are. They sometimes can be just a little bit of irritation, like on the nose or the cheek. And if you have one, you may find that it just doesn't heal, or it scabs over and it bleeds sometimes. Just think, what is this annoying thing I have on my face? And after about a year or so, you'll maybe have it looked at, and then it's like, oh, that's a basal cell carcinoma. So that is much more common than melanoma. So with melanoma, you're going to be looking for usually a dark mole that's changing. Its border is changing. It's becoming asymmetrical. The color is changing. It's getting bigger. Those are all signs that there's something funny going on with your mole. So if you have a mole that's changing in any way like that, it's growing lumpier, bigger, darker, it's bleeding, those are signs that you need to have that mole checked. Okay, so that's serious. We want you to have your moles checked. With non-melanoma skin cancer, it's also serious because we want to remove them usually. But what you'll find is you won't really kind of notice that it's there. So like I said, it's going to be a little area that's a little bit broken on your skin. You won't really see it. You'll kind of not really know what's going on. That's generally how they present. So people come and say to me, I have something here on my nose. I think it's from my glasses rubbing. And when I look closely, it's actually a small basal cell carcinoma. Now, treatment for all skin cancer generally is surgery. Not in all cases, but generally it is surgery. The issue with basal cell carcinomas is that they tend to occur on the face. Now, that can mean surgery to the face can leave you with a scar. So we have to be very careful how we remove these lesions. And we want to catch them early on when they're small to ensure that the scarring is small and that it kind of doesn't affect the way you look. So that's really what's important, at least to me, when I'm treating a basal cell carcinoma. Anyone can remove a skin cancer from the face. It's making it look nice after you've taken it away, which is important to me, but also, of course, to you if you're the patient. With melanoma, that also has to be surgically removed. They tend to occur on the body, though you can get melanoma on the face. It generally is more common on the body. So it's a little more straightforward with regards to scarring, though it's never nice to have a scar anywhere on your body either. So two kinds of skin cancer, non-melanoma and melanoma. Melanomas tend to be the brown ones. They're less common than non-melanoma skin cancers, but they are more fatal, if you will. So they spread more easily and the incidence of death is higher. Non-melanoma skin cancer is a lot more common, but it generally results in scarring and not long-term effects on general health. So there you go. Those are your main types of skin cancer. We believe that they are all related to sun exposure, though genetics and lifestyle factors plays a really large role. So the best way to protect yourself from having skin cancer is potentially to have regular skin checks. That may mean annually for you. It may mean every few years. It does depend on your family history, your skin type, and how much sun exposure you've had. Remember that most of your sun exposure, which has damaged your skin or is going to cause a skin cancer, occurred when you were younger, so under the age of 25. Though I wouldn't suggest anyone to go out in the sun a lot now. Anyway, if you're older, because burning is never good for your skin, and you can always cause changes in your skin in the sun when you're older as well, obviously. Smoking is also a bad idea. Smoking is generally bad for your health. It's also bad for your skin. So there you go. There's a rundown of skin cancers. In terms of protecting yourself, staying out of the sun is your number one way of protecting yourself. So don't expose yourself if at all possible. Wear a hat, sunglasses, and so on. Remember that non-melanoma skin cancers occur more commonly on the head and neck, and melanoma on the body. So there's a rundown, just like a 10-minute intro to skin cancer and how to look after your skin a bit better if you're concerned about that. And like I said, if there's anything on your body that you're worried about, have it looked at by your doctor.